Hello, I am Dr. Anil Kumar Vashne, Senior Director and HOD of Urology at Max Super Speciality Hospital, Shalimar Bagh. Today we will be discussing about urine-related diseases. And in urine-related diseases, the most important is the urine problem, decreased flow, urine in intervals, spotting blood in urine, and frequent urine in small intervals are common. People come with flank pain problem. People come due to extreme pain such as back pain of extreme severity or extreme stomachache. The patient is unaware that they must visit a urologist and go to an emergency ward instead. In a way, stomachache, swollen back, lump are all the symptoms of the urinary system. We need to visit a urologist. Patient of any age can have urological problems. Small children can have congenital urinary problems such as posterior urethral valve, in which urine comes at small intervals, or because both the kidneys are swollen, which we also called bilateral obstructive uropathy. Similarly, during adolescence, their urinary problems start, and with the onset of puberty, adolescents have the biggest problems, and the most common is phimosis. Phimosis is a condition wherein the foreskin does not retract. So this is a common issue we address. As children grow into adults and get married, there is honeymoon pyelitis, honeymoon-related infections and urinary tract-related infections which can be bothersome. Further, as age increases between 20 to 40, stone diseases are very common in men and women, but men tend to be 3 to 4 times at more risk. In men specifically, women do not have prostates. The prostate can pose problems and can cause issues with urine flow after 40. There's decreased flow and the prostate starts increasing in size. When prostate grows, it not only blocks the urine, but also there's a chance of the blood entering it. So damage to both the kidneys cause recurrent infection. Pus may form in prostate and lead to fever with chills, which we call prostatic abscess. In women, right from early age, there are conjunctival diseases. When female babies are born, epispedias is a problem. As they age, there is an increase in urinary tract infections, especially in women of marriageable age, and stone diseases are also very common in females. To diagnose the infection, the first symptom is burning sensation during urination, then blood in urine, after which fever can be accompanied with chills, and sometimes the pain is in the flank and the patient is in discomfort apart from extreme sweating and loin pain. These are infections, and when these infections spread in the blood, we call it urosepsis, which can be life-threatening, and the patient can suffer from weakness, loss of appetite, and more. Apart from this, we have a simple test which we called uroflowmetry. The patient urinates in the machine through which we get a graphic record. If the flow is poor, we call it obstructive flow, and by this we can get to know if the prostate has a problem, or we ask the patient how far does his flow go. If it falls near the legs, then it's the initial sign of prostate problem, or can be urethral strictures, where if the urethra shrinks due to reasons such as infection or any bruise, which can reduce urine flow. Inflammation can occur anywhere, and if it is in the urinary system, then the inflammation is basically a reactionary response due to bacteria, fungus, or any pathogen. We call this reaction as inflammation. For bladder health, I have told and mentioned earlier lemon juice, coconut water, cranberries, strawberries, and things rich in vitamin C such as pineapple, orange juice, pineapple juice, all are very good for our urinary system. Infections are also controlled and stone infections are prevented. This is a very important question for nephrologists, doctors who are specialists of kidney. Why is the kidney getting damaged and how to stop or prevent it from affecting the rest of the body systems. Excess blood pressure can cause the kidneys damage. Sugar can damage the kidneys. Consuming excessive painkillers can also be a problem. So all diseases associated with kidney failure are studied under nephrology. Once urine forms in the kidneys and flows through, a urologist is someone who looks after our drainage system, and a nephrologist is someone who looks after our kidneys. We can divide this in two. Urologists study the urinary system and male reproductive system and are specialists of two organs. The urinary system includes kidneys, ureter, bladder and urethra, and the male reproductive system, this model kept here, includes the prostate, seminal vesicles, these two ducts, these are testicles, and above the testicles where the sperms generate, we call it epididymis. This is the epididymis and this is vas deferens. This is all male reproductive system. Urologists often see patients with stone problems. The most common symptom being flank pain, which radiates from the groin and extends till the testes, and we call this ureteric colic. This is a condition where the stones which are produced in the kidneys, which happen due to people drinking less water or tend to live in areas where they sweat a lot. People living in Himachal or the northwest belts are the ones who suffer most from stones, and the patients say that the stone production increases during winter, and during summers when they get trapped in the pipes, they suffer the most from colic, ureteric colic. Bleeding, vomiting, infections, pyelonephritis may occur, pus may form in the kidney, and the kidneys may get surrounded by perinephric collection. So stone disease is such a disease that can damage the kidney. It is of utmost importance that in urology, uroflowmetry, and as I have told earlier, urine routine and culture, after that sensitivity test, ultrasound. There's a specific ultrasound called the kidney ureter bladder and post-void residue ultrasound, which happens twice, once on a full bladder and one on empty bladder, which we call stethoscope of urologist, is how we get to know about 90% problems of our patients.